Today I will be performing the skill of a sterile dressing change. I will make sure to follow all my GSPS protocols, my 11 patient rights, my 2 patient identifiers, assess patient for allergies, and do my 3 medication checks. I would knock on the door, introduce myself to the patient, explain the procedure. I would ask the patient if they had any allergies. I would ask them to identify themselves using the 2 patient identifiers, their name and their birthday. As they're saying their name and their birthday, I would check it against their bracelet to make sure they say they are who they say they are. Then I would ask them if they need any pain medication for this procedure. If they say yes, I would check the MAR, administer the medication if they have it, come back and assess 30 minutes to an hour later. If they're good, I can start the procedure. If they say no, then I can just go ahead and start the procedure. So first things first, I would make sure to do hand hygiene. Put on some clean gloves. I would remove the bandage by using a push-pull method to loosen the adhesive. If the adhesive is not wanting to come up, then I can use a saline solution to help loosen that. Then I would just pick the bandage up from the center. I would assess the bandage using the taco method, checking the type, the amount, the color, and the odor, and any drainage. Then I would just discard the bandage. Then I would remove my gloves. I would not do that. I would perform hand hygiene. I would use the taco method to assess the wound as well. The type, amount, color, odor. I would also assess the size, the appearance, the pain, and the appearance, but I think I already said that. Okay, so I've done that. Now I'm just going to open my sterile field. Okay, so then I would perform hand hygiene again. I'll move that up a little bit so I have some space. I would grab me a set of sterile gloves, opening that, throw this away. Now just to open, okay, with my non-dominant hand, I'm going to glove my non-dominant hand. So I'm going to pick up by the cuff, making sure to step away. And then I would just insert my hand. Whoop. Okay, then I would take my hand, not touching the outer cuff, but using my fingers to tuck inside the cuff. Work it onto my fingers. Using a baby hand, I would slip my hand in. Pulling it down. And then, because this one's rolled, I'm not going to bother it, but because it's further enough up on my wrist, so it's fine. Then, sterile can touch sterile, so I would just adjust my gloves. But if it wasn't rolled up, then I would just tuck my fingers in, just to pull down more. Okay, I'm going to throw this away. Okay, then now I can reach into my sterile field, my sterile basin. I would get out my cleaning swabs, rip those open, and then using one swab stick with the solution, I would clean from the top inside down. Then I would throw this away. My next one, I would just do the same thing, just on the outer side. I would throw this away. With my last one, I would do the same thing to the other outside. and then I would just stow these away. Next, I would dry using my gauze. Pat dry the center, working my way from the top down. Get a new piece of gauze. Coming over to the side, patting the outside down from the top, dispose of that. And with the last piece of gauze, just do the same thing to the other side. Oops. And then dispose of this. Then I would just remove my gloves, perform hand hygiene. I would grab a new pack of sterile gloves. Throw that package away. Then I would open the same way that I did the other ones, making sure not to cross my 1-inch border. Again, with my dominant hand, I'm going to glove up my non-dominant hand using the cuff. Making sure to not contaminate them. Okay. Then I would just use my fingers, wiggle my hands up in there. Using baby hands, I would glove this hand. Okay, then this one's rolled up, so because sterile can touch sterile. Just fix my gloves. Then I would trash this piece. Then I would take my bandage and then I would place it on top of the wound. My clean new bandage. I would take some tape. I would tape both sides. Then I would take another piece of tape, put today's date, the time, and my initials, place it on the bandage. And then I would just take my gloves off, perform hand hygiene, and then I would just document and record.